everyone. Welcome back. I'm happy to be here. And for those of you who don't know me or who are new on here, my name is Paige. I'm a nurse. I've been a nurse for 32 years. I've worked in emergency rooms, trauma ICU. I've flown with air ambulance, and now I'm a patient advocate. So I help people navigate the system, help them hopefully not fall through the cracks, because we all know how overstretched our healthcare system is and how easy it is to fall through the cracks and not get the care that you need. And there's lots of different ways that happens. And if you've watched my videos, you kind of know what some of those are. If you know somebody who you think would benefit from hearing this, go ahead and share this and bring them into the live. I do have some topics that I'm going to talk about, but I want this to be your space too, to be able to ask questions, be able to share experiences that you've had. My last live, we had about 1,800 people on here, and people were sharing different experiences. And often when somebody has experienced something in the healthcare system, or they've shared a way that they've fallen through the cracks, chances are there's someone else on here watching that has also experienced that. And it's been really cool, because then people will end up sharing different resources and offering support and all of that. So I just really encourage you to continue to come on the lives. I haven't got a set time yet, and I need to do that, but I'm working on it. Usually I do Tuesday evenings. I couldn't do it this week, so I'm doing it tonight. I also have a TikTok channel, and I do lives every Thursday night at 5:30 Pacific time. So I'm just doing this one a little bit earlier. And so, yeah. So anyway, if you guys have a time that you would really love, let me know, and maybe I can kind of work that out. Yeah. So anyways, I'm glad that you're here. I'm glad that I'm here, and we'll just kind of get started. But tonight is really all about education and community. I'm going to present some topics, but I do want this to be a space where you can share as well and ask whatever questions you have. Your stories are what brings these issues to life, really. Yeah, so please feel free to share in the comments as we go along. If I happen to miss something in the comments, make sure you either repost it or just say, hey, Paige, you missed this. And because I do want to hear from you guys, and that's really my heart, is to create a community where we can share experiences and talk about this stuff, because it's not talked about really a lot. So anyways, we're going to cover 4 big topics tonight. The first is the different types of biases in the healthcare system. And we all know that they exist, so I want to talk about them, maybe offer some ways to navigate around that. Second, what is medical gaslighting and how to communicate when you feel dismissed by your doctor. The third thing, if we have time, that I want to talk about is why the wait times are so long for either specialists or in the waiting room of your doctor's office or in the emergency room department. And finally, how to prepare for a doctor's appointment. So if we have time to talk about those things, then we will. And if we don't, that's okay. So, and if any of you have experiences and we get talking about those things, then I'm completely happy with that. Weston Quest. And if I say your name's wrong, I apologize. So hello, I'm glad that you're here. And if you're just hopping on here, I'll just introduce myself again. My name is Paige. I'm a nurse. I've been a nurse for 32 years. I've worked in emergency rooms. I've worked in trauma ICU. I flew with air ambulance, and now I'm a patient advocate. So I help people. Weston. Okay, perfect. And Yusuf, hi, welcome. And AKP 1078. Hello. If I say your names wrong, you guys, just bear with me. Anyways, so anyway, I've been a nurse for a long time. Now I'm a patient advocate, so I help people navigate the healthcare system. And we talk, if you see my videos, you know that I have a passion for helping people not fall through the cracks in the healthcare system, because as we all know that can totally happen. So I invite you to ask questions. I invite you to share experiences, and we're on here to just talk about those things. And I will go through some of the topics. One of the first things I was going to talk about, because these things have come up a lot. AKP 1078. Hey, hi guys. I'm glad that you're here. Is biases in the healthcare system. And oh, that's a tough one. And it's really an uncomfortable truth, because they exist. And it's not about individual bad actors. It's about a system where unconscious assumptions can lead to very difficult levels of care, or different levels of care for different people. Like, everybody should really have the same, but unfortunately, let me just, random guys, hi, welcome. Okay, I'm just reading this before I read side the table. Okay, if I don't understand the comments, then I'm just going to skip over them, but please feel free to ask questions or share different experiences related to healthcare. So we're going to talk about the biases that exist. So it's really important to recognize it so you can kind of advocate against it, right? So ageism is the first one, and this affects both the young and the old. A younger person's valid symptoms may be dismissed as just anxiety, or it's all in your head, or you're too young to be that sick. Or when you're if you're older, a senior, it could be a treatable condition, and it's often written off as an inevitable part of getting old. Like, well, you're just old, and that's kind of just something that happens. So neither of those are okay. And that's a bias in our system. So sexism is another one. There's significant data showing that women's pain and symptoms are taken less seriously than men's. It's more likely for women to be labeled as psychological or emotional, and that leads to delayed diagnosis for serious conditions. The next bias is racism. Research has consistently shown that patients of color, indigenous patients, are systemically undertreated for all kinds of things, and they often receive less, especially for pain medication. They receive less pain medication, while Caucasian patients have the exact same injury, and they might receive the proper medication or testing or whatever. And the last one that I just want to touch on is socioeconomic bias. Assumptions can be made on your appearance, right? Like how you show up, what your job is, what your address is, how you present. And it can totally influence a healthcare provider's attitude, even if the quality of care, and affect the quality of care that's offered. So there's ways to advocate against bias in the system. So the first one that I like to talk about is to use objective data. So focus on measurable facts. Instead of saying, like, I feel awful, say, I've had a fever of 102 for 3 days. The data is harder to dismiss than your feelings, if that makes sense. Also, bring an advocate. Bring someone with you. Having a friend or family member with you can change the dynamic completely. And if you have watched my videos, you know that I push that a lot. It's really, really important and necessary, in my opinion. But that extra person that's there, having a third party involved can completely change the dynamic. They can serve as a witness. So if you're being dismissed by your doctor and you're sharing, your different symptoms, and they're dismissing you, this person can kind of say, well, actually, I saw Susie Q, I don't know, couldn't sleep or couldn't go to work or whatever. Like, they can kind of validate your side of the story. And you can, make sure that you request documentation. A calm, powerful phrase that I've told lots of people is, please document my concerns and your decision not to investigate them in my chart. It just creates a formal record, and it gives the doctor just a brief second to think about that. And often you can see the wheels turning, and they might just, they might just tweak their perspective a little bit. And know your rights to a second opinion. So I get it. I understand that it's not easy to get a second opinion. It's not like you can just go stand on the corner and get a new doctor. There's a doctor shortage, 100%. But it's still possible, and there are nurse practitioners, and there's telehealth, and there's new clinics that are opening up that are doing mostly virtual healthcare, but they're only on evenings and weekends, and a lot of them are taking new patients. So there are things to do, but yeah, I don't want to say that lightly, to just go get a second opinion, or just go get another doctor, because it's not that easy. And if you have a chronic illness, you need a primary care physician. So I don't recommend firing your last one until you find someone new. So anyway, I'm just going to scroll here because I want to make sure I don't miss any of your comments. Weston, hi. What does ADHD mean? Oh, you have it. Okay. ADHD is attention deficit hyperactivity disorder. So it's a mental health illness. And I don't know if they've diagnosed you with that. Have they not explained kind of what it is and what that means? And claustrophobia is when you have a fear of tight spaces, like closed in spaces. And for different people, it can be different things. Some people can't go into an elevator. And some people can go into an elevator, but can't like go into a CAT scan machine or an MRI machine because they feel, so that's what that is. It's a phobia. It's a really extreme fear. If I say your name's wrong on here, Kikope. Sorry, I apologize. I've had pain for 4 days straight on your right side and it won't go away. Oh my goodness. Should I go see a doctor? Because you're not 100% sure, but it might be your gallbladder. It could be appendix. It could be, what side did you say it was on? Anyways, yeah, it could be a few different things. I'm not a doctor, so I can't obviously give medical advice, but if it's been 4 days and it's been like it just won't go away, I would absolutely go get it checked. And if you have, like, if it's getting worse, if it's keeping you up at night, if nothing relieves it, if you start getting a fever or start feeling unwell otherwise, then I would go to the emergency room. If it's something that's kind of manageable, then I would maybe, go to your doctor and your family doctor. Okay, KQ4949. Hey, Kick, let me know if that helps a lot. Okay, bye, Weston. Thanks for hopping on here. And that's great. And you guys share this with somebody. If you know anyone that's struggling with anything in the healthcare system, make sure that you share this with them and bring them into the conversation, or you can send it to them after or whatever. But yeah, go ahead and share it. I really appreciate when your likes and your support on here. It's awesome. Kick. I'm just going to call you Kick, okay? That's easier for me. I've been throwing up. I do have a fever every now and again. Can't keep any solid food down. Yeah, so it could be a number of things. I would absolutely get it checked. And if it's keeping you up at night too, regardless, if it's been 4 days of that, 100% I'd go get it checked. Yeah, thanks for sharing that. I know it's a bit weird to be so vulnerable on like a social media platform and share those kind of things, but it just kind of really starts some good dialogue. I hope you have a family doctor, someone that's good. But honestly, if it's been 4 days and you're feeling that awful and can't keep any food down and you've had a fever, I might just go into the emergency room. And I get it. I was going to talk a bit later about wait times in the emergency rooms. Oh my goodness, it can be daunting, but we can kind of talk about that. But I think most people have a story about a frustratingly long wait time. And sometimes you're waiting in the doctor's office, waiting to get in. Sometimes it's waiting in the emergency room. And it is a pretty major flaw, especially when it happens in a doctor's office. It doesn't, in the emergency room, yeah, it's not a first come, first serve, right? It's a triage system. And so it's a constant process of reevaluating people that come in based on severity. So a patient with a stroke or chest pain will always go before someone has a broken ankle or something. It's about saving life before other things. So, oh, hey, Weston, welcome back. So yeah, so that's sometimes in the emergency room, the wait times it's tough because there's not a lot that can be done. I mean, our system is just overstretched as it is, and there just aren't enough doctors, there aren't enough resources, there aren't enough beds in the hospital. So that one's a little bit, it is frustrating, I get it, but there's reasons why the wait times are so long. That's one of them. The other one is staff shortages. So most hospitals and clinics are chronically understaffed. There just simply aren't enough nurses, doctors, technicians to see everybody. And like I said, in the hospital, there's a lack of inpatient beds. So often the ER is full of people who are actually admitted into the hospital and they're waiting for a bed to open up on one of the floors. And so it creates a bottleneck, and no new patients can be brought back from the waiting room. Like there's just literally no beds. And you probably, I don't know if you have experienced this, but you probably know someone that has seen people in the hallways, like stretchers in the hallways in emergency rooms, and even up on the wards, on the units. I've seen where all the beds are full, and then they start making like individual kind of cubby holes along the wall in the hallway for patients. So it's just pretty bad when it happens. When the long waiting in the waiting room happens in a clinic, usually it means the clinic is overbooking. So the family doctor's offices might overbook appointments, assuming I've heard them say, like, well, some people just don't show up, right? But then when everybody does show up, the schedule falls behind quickly, or maybe one patient takes longer or whatever. But you're always rushed through your appointments, and then there's usually this big long wait time. So there's a few things you can do, like for the emergency room, you can call ahead if it's safe to do so. I mean, obviously, if it's life-threatening, you don't wait. You call 911 and you go with the ambulance. Or if somebody's driving you and you're quite sick. But you can, like, some emergency rooms will give a general sense of their current wait times. So if you have time, like if it's safe for you to do that, just give them a call, explain your situation, say, I'm thinking of coming in, and understand too, though, they might say, things are pretty okay right now, so why don't you head in? But you have to understand that can change in an instant, because you get in there, maybe you're even triaged, maybe they even like check your blood pressure, maybe they even take you to the back, and then there's a big car accident, right? And so that can change, but it doesn't hurt to call. For the clinic wait times, try to book the first appointment of the day or the first one right after lunch. They're the least likely to be delayed. Go prepared too. Like if you're going to the emergency room, bring a charger for your phone, some water, a snack, like just kind of maybe a book. Just assume that you're going to have to wait. And you can check in politely too, like politely being the key word, because the nurses in triage or at the front desk in a medical clinic, they're overworked too, right? So you don't want to add a bunch of more onto their plate. But if you've been waiting a long time, it's totally okay to just politely check at the front desk for an update. Or at the triage nurse, if your symptoms are getting worse, this is particularly when you're in the emergency room. If your symptoms are getting worse while you're waiting, please don't wait. Just go up to talk to the triage nurse again and just tell them, like, my symptoms are getting worse, and then they can usually re-triage you again. So, okay, I'm just gonna scroll because I don't want to miss anything. Weston, you got a YouTube channel. Excellent. Okay, Kick, another thing also might not help is you have anxiety and this pain. I don't know what it is. Okay, and you don't have insurance, so you might have to wait till Monday. Do you have? Yeah, that's a whole week is a long time. So when you say you don't have insurance, that means to go into the emergency room. Do you have a family doctor? Like, do you have a primary care physician that you could even just call tomorrow? The other thing you could do is, because what would you do if something bad happens over the weekend, right? Like, you'd have to go into the emergency room. So I'm nervous you waiting till Monday, but I get it. And anxiety, that probably doesn't make anything easier either. It doesn't make the pain better, that's for sure. I'm really sorry you're experiencing that, Kick. That is hard. I'm just going to give you 1 second here to see if you respond. I'm sure that you will, but I'm going to keep going here. So the YouTube videos, they stay up on YouTube. So I kind of don't want a bunch of dead space in case people are watching later. It stays up permanently until I delete it, and people just watch it over and over. Whereas on TikTok, when I do lives on there, it's often a lot more interactive. There's usually more people on there too, but I have no problem just kind of sitting and waiting and for people to respond. So, but on here, my lives tend to be a bit shorter, and I'm going to be doing a TikTok live right after this one. Well, I might take like a 10 or 15 minute break. So if you're on TikTok and you want to join again where it's a little bit more interactive, then please come over there. And it's just my same name and everything. Okay, so Kick. You don't have a current family doctor currently. Oh my goodness. So, well, so you don't have insurance to even to go to the emergency room? Like, I guess what I'm not understanding is why you would need to wait until Monday. What's the difference between Monday and tomorrow, for example, Friday? Okay, I'm gonna just, while Kick is responding, I'm gonna talk a little bit about, funny Wi-Fi, a little bit about preparing for doctor's appointments, because as we were talking about, and Kick, I will come back and scroll and find your responses, so go ahead and respond while I'm talking, if you want to. So as we were talking about like the wait time, so you wait and wait and wait for your doctor's appointment, and then you finally get there and you get in, and then you forget what you were going to talk about, right? Or you get intimidated, or you get anxious, or you get white coat syndrome, which is a real thing, where you freeze and just kind of forget what you were talking about. So I'm big on preparing for your appointments. It can be overwhelming. Your appointments can be really overwhelming. It's easy to forget your questions. Proper preparation is the key to getting the most out of your limited time, because often they only give you like 5-10 minutes. So I like to have a checklist. So the first thing on the checklist was like, what is the number one most important thing that I need to accomplish in this doctor's appointment? And then I write it down. What are my top 3 questions? Don't bring a list of 20 questions, because there's not time, and there aren't 20 things that are a priority. But focus on your top 3. Bring your medication list. It includes and some people bring all their bottles even, but it includes the prescriptions, like over-the-counter supplements, vitamins, all the dosages, how often you take them. And just bring a list with you to the doctor. Summarize your symptoms, so have a clear, concise timeline about what has been happening, and be as specific as you can be when you're writing these things down. And write everything down. Bring notes with you, because it makes it so much easier. You can even, if you freeze, you can even just hand it over to the doctor and say, this is what I want to talk about. And really, really important, as I was saying earlier, is bring someone with you. They can be a second set of ears. It's a second person to hear things, because our retention level is pretty low. And I think I read a stat where, I should really look it up, because I've mentioned this a couple times in lives, but so myself, I'm fairly healthy. When I go to a doctor's appointment, apparently, according to stats, I only retain about 3%. 3%! So if you're sick and you're feeling unwell, is it 3 or 13? Maybe 13. I'll give myself the benefit of the doubt. But anyway, it's low. And when you're sick, or you're frustrated, or you're, all of these things, you can imagine that your retention goes down. So that's why another reason to bring someone with you and have someone there with you. They can kind of help you speak up if you get stuck, or if you forget something, or if the doctor's kind of dismissing you and being condescending, or not believing you, or looking at his watch, or rolling his eyes, like all of the things that can happen. They can kind of speak up for you and excuse me. So it's really important, because it's hard when you're not feeling well, or you're scared, or you're frustrated, to advocate for yourself. It's totally doable, but it's a lot easier when you've got a buddy with you, or a family member or something. The other thing that can happen when you have a third party there is they're then a witness. And so often the doctor will become a bit more accountable, because they know that there's someone else there. And just, emotional support as well, right? It's just nice to have somebody there in your appointments. And especially for important appointments where maybe you're getting test results, or maybe you have a chronic illness and you're discussing your treatment plan. Really, really important to have someone there with you. So let me just check on Kick. So Monday, because your mom reads in a prison, so she can only do it. Okay, that she can take you. She works in a prison. Okay, so she can take you on Monday, is what I'm guessing. But there's no one to take you tomorrow, or even I get it now. But please, if things get worse, if you get a fever that is persistent, and you keep throwing up, and you can't keep anything down, you're just feeling worse and worse, because 4 days is a long time already. So what can happen is then it turns into like a real emergency. So, but please promise me if it gets worse, just go into the ER. And, you know, I don't, yeah, I know that's easy for me to say, but I want you to be okay. So thanks for sharing that. That's what an interesting job working in a prison. I at one time considered doing some forensics nursing and working in kind of that areas, but I never did. I chose critical care. So if you're just joining on here or you're new and you don't know me, my name is Paige. I'm now a patient advocate, so I help people navigate the healthcare system. I've been a nurse for 32 years, mostly emergency rooms, trauma ICU. I've flown with air ambulance. I've done some detox nursing, so addictions. I did that for about 4 years, kind of just a change of pace, and I loved it. It was great. And I've done a little bit here and there. I've done some remote nursing, some operating room, recovery room, different little kind of sabbaticals here and there. But anyway, now I help people navigate the healthcare system. So I'm just going to give Kick 1 second here. Okay, so the other thing I'm going to talk about quickly is my book. So as you probably noticed, my my channel is Paige Lennox Books and Patient Advocacy. I'm an author as well, so it started out as a platform to talk about my books. And I've read You Promise, Kick. Okay, thank you. Thank you very much. And feel free to message me like privately too if you have other questions. I'm totally fine with that. Your mom is she's a nurse in the prison. Oh, interesting. Oh, very interesting. And I imagine she would say the same thing to go get that checked. Anyway, so I am an author. I've written a bunch of different genres of books. And so what happened is I started this channel, and then I wrote a book on navigating the healthcare system and how to, it's called Unlocking Healthcare. And so, yeah, then clients started saying, well, can you post a video about this? And can you post a video about that? So this patient advocate work is really my passion, and it's something I have a lot of knowledge in, and there's lots I don't know though. So anyways, but anyway, the book, so this is the book, then this channel just turned into what it is now. So it's great. I love it. But I want to show you about my book. It's a guidebook. So it is not a book you read start to finish, anything like that. It's an actual guidebook. So I'll just kind of show you briefly. So I'm really nerdy, so it's all color coded, but it's got chapters on all different parts of the healthcare system. So knowing like patient rights, preparing for appointments, advocating for a child or an elder, mental health and addictions, understanding tests, referrals, newcomers to the country, so where English is a second language. There's a chapter for caregivers, there's end of life stuff. Yeah, kind of a little bit, there's LGBTQ, seniors, so a little bit of everything. So you basically find your chapter that is applicable to you, and then it's all color coded. So then you just kind of turn to it and it matches the color. And it's big letters, lots of resources in here, places to put notes. Yeah, there's a few stories in here too. So anyway, it's on Amazon. The link's in my bio and also in the description on all my videos. So okay, I'm just going to scroll here and make sure. Remy, hi. Love your videos so much. Having autism, I have problems either communicating, and your tips are extremely helpful. Oh, thank you so much for saying that. You just made my day. I really appreciate that. That's validating and encouraging. And so this platform, that my lives are basically an offshoot of my videos, but if you have questions, I'm totally happy to answer them if I can. If I can't, I'll find out and get back to you. Also, I've had people sharing different experiences on here as well. I was explaining a bit earlier, so I have a TikTok channel as well, and I'm doing a live right after this one. I do my live there at the same time every week. I'm just kind of figuring out the best time for my YouTube lives. But the TikTok videos don't stay up, right? They just kind of disappear. So they're a bit more interactive, and I'll sit and kind of wait for people to respond, and it's a little bit less me talking all the time. Well, I'm still talking, but it's driven by you guys. Whereas on YouTube, the video stays up, so people can watch it over and over and over again, or just come, if they come across it and they want to watch it. So I try not to have a bunch of dead air time. So I'm usually just kind of talking. But I also love talking about what's important to you guys. And if there's no questions or anything sharing going on, then I'll just kind of talk about some topics that have been relevant recently or whatever. So anyways, I'm glad you're here, and thank you so much for saying that. I really appreciate it. So I was going to talk about medical gaslighting and effective communication, like how to communicate with your doctor. So this might be really good for you. I hope it's okay. I'm just calling you Remy. It's like the short version of your name. This actually might be really relevant because, yeah, that's exactly what you just shared. So medical gaslighting is when, what's the best way to describe it? It's when a healthcare provider of any, it could be doctor, nurse, it doesn't matter. Often it's a doctor. From my experience, they dismiss your symptoms, they deny your experience, they make you feel like you're exaggerating or that it's in your head. And so there's some ways to really, Remy is your, okay, gotcha. So it's just your first and last name together. Awesome. So anyway, so here's how to communicate with your doctor so that, how did I find you? I was watching YouTube shorts. Yes, I'm on YouTube right now. That's so funny. I have both. So we're on YouTube right now. And that's what I do, is a bunch of my shorts. And so, yeah. But now this is the live. So I do both. I do both TikTok and YouTube. So I was just kind of explaining the difference between the two lives. So that's hilarious, Weston. Okay, so let's talk about how to communicate with a doctor when they're dismissing you, or if you feel intimidated, or you get lost, or you're feeling kind of scared and not really sure where to go from there, which it sounds, Remy, like that is something that you're struggling with. So prepare a clear opening statement when you go in. And I'm not trying to make this sound too formal, but it's really important, because if you kind of go in and they're looking at you and you're like humming and hawing, and write this stuff down, like bring a piece of paper in, because what you can do is hand them the piece of paper. If you get stuck or you're having a hard time like speaking or communicating with them, all you have to do is hand them the piece of paper and say, these are the things I really want to talk about today, and I'm feeling kind of nervous, or I sometimes forget to say the things that I need to say or ask the questions. And so I've decided I'm going to start writing it down, and I'm just going to give it to you. That's one option, or you can read it yourself. So start your appointment with like a focused summary. So kind of a one sentence thing, like for example, I'm here today because I've been experiencing sharp stomach pain for 2 weeks, and it usually happens after I eat. Like something like that, right? Just to kind of sum up why you're there. Use a symptom journal. So whatever's going on for you, whether it's physical health, mental health, whatever it is, like keep a simple log of your symptoms. It could be in notes on your phone. It could be an actual written, like a notebook, but put the dates, times, severity. So if it's something like pain, like how, I don't know, pick a scale, like do the 0 to 10 scale, or, a way to kind of measure it. Write down what makes it better or worse. And you can bring that with you too. And when you present this data to them, and you can say like, this is what's been going on for me. It shows that you're serious, and they're more likely to pay attention, take you seriously, not dismiss you. Also, when you're communicating, really important, and this is just communication 101, and I don't do it all the time. I will not say that I communicate perfectly all the time. Far from perfect, actually, but use I statements. So it's a technique that's talked about a lot when you're learning about communication, and it's non-confrontational, which is really important in the doctor's office because there's a lot of egos in the doctor's office. So instead of saying like, you're not listening, try saying, I'm feeling unheard right now, and I'm still very concerned about this symptom. And just be really persistent. Like if you feel like you're being dismissed, just keep being really persistent. This works really well to ask for a differential diagnosis. So if a doctor lands on like one explanation, like they're taking all your symptoms and saying, well, it's because you're anxious, or they just don't believe you, like it's in your head, or it can't be that bad, or you're depressed, or whatever. Like they use something else and they kind of land on that. They won't change their mind. They won't budge from it. You can just kind of ask something like, thank you for that idea or that insight. What else could this be? Like, I get that you think it's anxiety and in my head, but what else could it be? Like, what's the differential diagnosis? That's a really good term, differential diagnosis. It prompts them to think a little bit more broadly. Like, they don't just get narrowed on their bias, whatever their bias is. It could be you're too young to be that sick, or you're too old, or you're too this or that, or whatever. It gets them to think a little bit more broadly when you come right out and ask, straight up ask. And then the other thing that's really helpful is the what if we're wrong technique. So it's just a respectful way to challenge a diagnosis. Like, same thing, if they've kind of made an assumption, or they've come to some kind of a conclusion that you don't feel is accurate, or you don't feel like they've taken you seriously or really heard you, you can say, I understand that you believe this is muscular. I'm just thinking of an example. But what could say you've got back pain, right? You're young. Well, I guess it doesn't matter how old you are. You go in and you've got this back pain and it's just not getting better. And they say, well, it's probably just a pulled muscle, or you're too young, or you look too well to be in that much pain, or are you sure that this isn't, being exaggerated in your head? Like, there's so many different ways that people can be gaslit in the healthcare system, and I've seen a lot of it. But so say something like that's happened, and you can kind of say, like, I understand that you believe this is muscular or anxiety, but what would the plan be if it turned out to be something different, like a nerve, something, a disc compression in my back, or whatever, like whatever is going on for you, like what symptoms should I watch for? So kind of just saying, what if we're wrong? Like, I hear what you're saying, Dr. So-and-so, but what if we're wrong? Like, what if, and keep it in team language, like we, right? Doctors, they like that. They like to kind of feel like that you're a part of a team, if that makes sense. So anyway, I don't know if that's helpful at all, Remy. There's lots, so I've done lots of videos on different ways to kind of communicate. And I don't know if there's like a specific problem that you have with the communication part. Like, is it because you kind of forget what you want to ask? Is it, those are all the issues that you struggle with. Okay. Yeah. So I don't know if that's helpful, but the big ones for, those things I was talking about is to write stuff down, like prepare. Make sure you prepare before your appointment. Like really, just really be prepared, and then bring someone with you. So those two things can really help in a big way. And if you don't have anyone to go with you in person, just get somebody like a friend. It just needs to be someone that has your best interest at heart, and put them on your speakerphone during the appointment. And just, you don't have to ask for permission. You can just kind of say, like, I have my brother on the phone, and I just don't want to miss anything important that you have to say. So, and you can do the same if you're recording it. Just say, I'm going to record this because I don't want to miss anything important that you have to say. And that they usually are okay with that. That's really helpful. It's mostly you feel judged. Your doctor's appointments stress you out. Yeah. So you feel judged, and I get it. So that's part of that same, like, gaslighting, bias, judgment, that kind of stuff. So yeah, so those two things, like, really I can't even speak. Get prepared. Be prepared before your appointment. Go in prepared, and just kind of like, this is what I want to talk about. And you can, if you feel judged, you can just, I don't see anything wrong with calling that out. And it's like anything, you don't want to be attacking, right? So it's the way that you say it. But if you say, like, you're judging me, if you kind of go in aggressively, it's not going to go well. But if you say, I feel like, I feel judged right now, and I'm wondering am I accurate in that? Like, are you judging me? And I don't see anything wrong with just sharing your heart, right? And I feel like you're judging me. I don't know if that's right or not, but I'm worried about whatever the symptom, whatever you went to the doctor about. Like, I'm worried about this, and I don't know what to tell you, but I want to look into this or whatever. So I don't know. Yeah, the stress thing, and bringing someone with you or having someone on your speakerphone can really limit it can bring your stress level right down. And if you start to get kind of anxious and escalated a bit, just kind of say, oh, I'm feeling a bit anxious right now, or I'm feeling nervous. I wouldn't use the word anxious, but I'm feeling kind of nervous, a bit overwhelmed right now. I just need to stop and take a breath for a minute. And, just saying, like, I often, calling it out, never thought of it, but it seems helpful. Yeah. Or just saying, doctor so-and-so, I get nervous coming to the doctor, coming to see you. And that's my stuff. Like, it's not because you're, I feel like I'm a bit judged by you. You can say that totally, but just say, I get nervous, and whatever, these things happen. And just even saying, like, they say if you're going up to public speak, you go up and you just tell people that you feel like, I am scared crapless right now. And it just kind of, it deflates the stress level. So just even saying, I get nervous when I come here, because I sometimes feel judged, and I don't know if you're judging me, but I hope not, because this is a really important relationship with my doctor, and I'm quite worried about these things. So just kind of, you might want to try that. But presentation is everything, right? You have to be calm and respectful, and it shouldn't be that way. You shouldn't have to do that, but it might help. I've seen it help quite a few people. So anyways, I hope that that's helpful. You guys are awesome. Thanks for sharing that, Remy. And I'm sorry that you've experienced that it is hard. And there's so many biases in our system. Like, there's ageism, like we talked about earlier in this live, ageism, there's sexism. Often women are treated different in different situations. There's racism, socioeconomic. I did a video about, like, how you look showing up in the emergency room. Sometimes there's biases that happen. And if you show up all grubby and dirty and you haven't showered for 3 days, you could be completely, it's just because you've been really sick, and you might get treated differently. So it's unfortunate that it's that way. I've been a nurse for so long, and I've seen so much of that it's just so hard. So, okay, you guys, well, I'm going to hop off soon here, and I am doing a TikTok in about probably 15 minutes live if you have more questions. But thank you so much for your participation. Check out my book. It might be helpful. And we covered some really crucial topics tonight. We talked about bias in the healthcare system. We talked about communication, wait times in both emergency rooms and in doctor's offices, and then preparing for your appointment. So thank you so much for sharing your personal stories. Yeah, you guys are just awesome. So it's just really powerful when people share their experiences as well. So thank you, and I'll see you soon. If you haven't already subscribed to my channel, go ahead and do that. And I appreciate any kind of feedback or comments on there as well on my videos. Okay, you guys, have a really good night, and we'll talk to you soon.